All right. Well, welcome everyone, and thank you for joining us today. I'm Emily Hinsey, the Director of Programs for Grantmakers in Aging. Grantmakers in Aging is a community of funders mobilizing money and ideas to strengthen policies, programs, and resources for all of us as we age. I would like to thank the John A. Hartford Foundation for supporting our monthly webinar series, and also thank the Archstone Foundation for their support in planning today's conversation. We will be making today's presentation available as an audio recording, so we will be sending that out in the next few days. Today, we are highlighting a partnership with SAGE and the California Association of Area Agencies on Aging, supported by Archstone Foundation, and illustrate how SAGEcare, which is SAGE's culturally competent training program, is being provided to area agencies on aging in California, but also in other states across the country. And I'm going to start it off with having Jasmine Laksamana, who is the program officer for Archstone Foundation, as well as governance chair and secretary for the Grantmakers in Aging Board of Directors, to share a little bit about the foundation and their investment to support the partnership. So welcome, Jasmine.
Good morning or good afternoon. My name is Jasmine Laksamana, program officer at the foundation. Archstone Foundation is a nonprofit private foundation dedicated to improving the health and well-being of older Californians and their caregivers. Our current grant making centers around the concept of integrating health and social services. To achieve this vision, we have centered our grant making around 3 T's, which are teams, training, and technology. Promoting teams, enhancing training, and improving technology are our pillars for improving care coordination, expanding the definition of care to include social services as well as medical treatment, and ensuring that care for older Californians is increasingly equitable, just, inclusive, and embracing of diversity. In line with these principles, Archstone Foundation is glad to support SAGE, especially the SAGEcare program and their partnership with the California Association of Area Agencies on Aging to reach California's AAAs to provide this essential cultural competency training. Now I'd like to turn it back to Emily Hensley to introduce our panelists for today's webinar.
Great, thank you, Jasmine. All right, well, we have a team of speakers that we're going to engage in a conversation today. So I want to welcome Sadia Abjani, who is the Director of Training and Instructional Design at SAGE, Cheryl Wayland, who is the Senior Director of Special Initiatives and Partnerships with SAGE, and Michael Costa, who is the Executive Director for the California Association of Area Agencies on Aging. So thank you for being here, and a note to our audience that we will have time for questions toward the end of this conversation. So as we go along, if you have questions, just drop them in the question box at the bottom of your screen, and we will engage the speakers with those questions. So, but to start, I'm going to turn it over to Cheryl to start us off with some background on SAGE, and then we'll go from there. So Cheryl, thank you so much.
Thank you, Emily. It's really a pleasure to be here today with all of you, and also just a special thank you to Jasmine and the Archstone Foundation for their support of this project. My name is Cheryl Wayland, and my pronouns are she and they. And I just wanted to briefly start out by sharing a little bit about SAGE. We are the country's oldest and largest organization dedicated to providing advocacy and services to LGBTQ plus older adults across the country. We were founded in 1978, and our headquarters is in New York City. We provide direct services in New York City as well as South Florida. And then we also have a number of national programs. And today I wanted to share just briefly about a couple of those national programs that may be of interest to this webinar and those of you listening today. First is SAGEcare, and that is our training and credentialing program. And Sadia is going to be joining here in a little bit to share a little bit more about SAGEcare specifically. Another program is our National Resource Center on LGBTQ plus aging. And this program is funded by the Administration for Community Living. And through this program, we work very closely with the Aging Network, providing education, resources, and technical assistance to area agencies on aging, ombudsman programs, state units on aging, senior centers, home care companies, really just anyone that's providing aging services. We're there to help support them and provide technical assistance. And then another program I wanted to share about is a program called the Long-Term Care Quality Index. And that program is working to provide best practices, policies and procedure review for long-term care retirement communities across the country. And our goal there is to really encourage long-term care communities to embrace LGBTQ plus inclusion, to make sure that we're providing safe and welcoming services for LGBTQ plus older adults, so that as they age, they'll have a place to call home within our long-term care communities. So there's three other programs I just briefly wanted to touch on this morning, and I will now turn it over to Sadia to share a little bit more about SAGEcare.
Hi, everyone. Hopefully you can hear me. My name is Sadia. I use she, her pronouns, and I am the Director of Learning and Instructional Design at SAGEcare. So SAGEcare is a cultural competency training and credentialing program. We credential elder care providers across the continuum of care on how to work with LGBTQ plus older adults. So these include trainings that are live webinars, that are videos, that are interactive online courses. And when you think of interactive online courses, you may think of the courses you have to take when you get a defensive driving course. They're boring, or like the tech courses you have to take, those are also quite boring. Ours are very interactive. They're focused on real live application, lots of animations. I'm very proud of them because I built them, but also they're pretty darn good. So we build courses that are really focused on cultural change. How do you impart to your coworkers and your staff members that caring for the entirety of the aging population is part of your DNA? That it's not just about the individuals you agree with, but it's about everybody. So SAGEcare is really focused on providing culturally competent care and person-centered care, person-directed care to LGBT older adults. And I'm gonna hand it to Michael to talk about the AAAs in California.
Okay, thank you, Sadia. My name is Michael Costa, and I am Executive Director of the California Association of Area Agencies on Aging, which is far too many words. And so we call ourselves C4A for short. And we're the association that represents the 33 AAAs in California. I always find that I have to explain a little bit about what AAAs are, because although they are a centerpiece of the aging service delivery system in this country, a lot of people don't really know very much about why they exist. They were the Older Americans Act, which was a Great Society program passed in 1965. Established a commitment on the part of the federal government to provide and support aging services for individuals over 60 who were vulnerable, and the intent was to help them remain in their communities for as long as possible. In 1973, the act was amended to allow for area agencies on aging, which were seen as the vehicles for the delivery system. So it took a few years for that to actually be put in place. And I'm happy to say California was early on. We had 3 AAAs established in 1973, which have grown to 33 over the years, and we cover the entire state. So we provide a range of services to individuals over 60 and also those living with disabilities. And that includes information and referral, case management, respite services, nutrition support, and also many of the AAAs actually, depending on how they are set up locally, actually manage adult protective services, for example, or in-home IHSS services. And so the actual menu of services a particular AAA offers varies among AAAs. It is also true, and this is important to keep in mind, that some AAAs are mainly pass-through entities. They actually provide a funding stream to local community partners to provide all those services I mentioned before. And then a lot of AAAs are a mix between those that provide services and those that don't. And then there's some that actually provide a whole range of services on their own and don't necessarily relate a lot with community partners. So the task for a AAA system like that, for any of the AAAs, is to make sure the staff that their own staff are culturally competent and sensitive to the individuals they serve directly, but also to work with their community partners to provide services that allow for training and development in the area of cultural competency. So we have, two AAAs have that kind of bi-focus in their in relation to this. So I'm happy to be on this panel. Thank you to both Grantmakers in Aging and to Archstone for making this possible. Now back to Emily.
Well, thank you. Thank you, Michael, and everyone for giving that context. We're going to have a conversation now around this work. And so I'll invite our panel to come back on camera. And so I'm going to start it off with just kind of a general question of the partnership and what has that looked like between SAGEcare and with the California network. What is that looking like? What are the components of the partnership?
Thanks so much for the question. So the partnership would not be possible without the work that Cheryl does in the National Resource Center. So through the National Resource Center, we have a grant to provide SAGEcare training to all of our AAAs. So that means engaging with all of our AAAs for free, not really for free, through the money from the National Resource Center. But for free, we provide trainings to all the AAAs throughout the United States and train them on how to work with LGBT older adults. And I think Cheryl's going to talk a little bit about how this is possible, and Michael's going to talk about the impact. But I think my important component here is to inform individuals that because of so much discrimination against our community, because of employment discrimination and housing discrimination and all of the ways in which LGBT older adults have been criminalized for just loving someone of the same sex or loving someone that doesn't conform to our understanding of what it means to be male or female, it's made it difficult to exist in this world. And so we maybe don't have the amount of money to engage experts or go to doctors on our own. And what that means is we lean on our community environments. We lean on our community offerings, like our AAAs, quite a bit. So it's even more important that our county and city offerings are trained, are able to provide services, because without that, our community doesn't flourish. And I think people don't understand that enough, that it really does run down to or come down to what folks like Michael and his team are able to provide. That's what makes it possible for our community to flourish.
Yeah, that's great. So Cheryl, should I tee it over to you then? Because I think it's interesting that, started in California as kind of the model, and you've seen this expand. So what are you seeing in terms of some of the successes and how you're really promoting this type of training across the country and within that network of AAAs.
Yeah, thank you, Emily. Um, and I'll go back just a little bit before this specific partnership with Archstone and C4A. In 2018, we were actually contacted by the state of California to launch a training for state units on aging and the area agencies on aging in California, leading up to some of the legislation that had been passed in California back in 2018. And so we, because of our funding through the Administration on Community Living, we were really committed to making sure that we helped California get off on the right foot. And so I believe we trained around 5,000 people that year, just to make sure that people had the basics. And, this was really around, how do we interact with LGBTQ plus older adults? How do we ask inclusive demographic questions related to sexual orientation and gender identity? And so we were really excited to see that work happen in 2018, and then to continue that work now through this project, with the relationship with SAGE and C4A. Sadia has been able to deliver a number of webinars with the support of Michael to make sure that we were continuing to reach out to the C4A network. And, for me, the area agencies on aging really hold that critical place across the country. Through the National Resource Center, we receive requests for information, from people in rural Arkansas, to Sonoma County in California. It just varies. We're getting calls all over the place. And our area agencies on aging are the entryway to aging services. So many places across the country do not have LGBTQ welcoming programs or exclusive programs for LGBTQ plus elders. So it's critical that we're able to lean into these partnerships with AAAs and organizations like Michael's to really bring together the aging network in support of LGBTQ plus older adults.
Mm-hmm. Yeah. So Michael, how has this been? Talk us through kind of the process within the network. How many AAAs are part of the network? Some of the background there, and how has this been received and really implemented within all of those organizations? Oh, and you are in mute.
It's to unmute. Sorry about that.
That's okay.
So, obviously it has varied across California in terms of the AAAs that have embraced cultural competency training. What we did as an association is working with SAGE is offer 3 different webinars a year ago. And one was a general webinar that just gave you a lay of the land and what the context is. Second was a webinar that was organized around trans issues. And then the third webinar was organized around particular issues and context around people of color. So that was offered to all of our members. We had a very good attendance rate, and that was a service we could provide as an association. Independent of that, individual AAAs across the state have also, engaged in cultural competency training, working with SAGE, and it's taken 2 different forms. One is I'm going to use a AAA that includes our state capital, Sacramento, and 7 other counties, and and that includes counties up in the Sierra Nevada mountains. It's generally a rural county, with the exception of the state capital. And last year, 43 staff members who work for this 7-county AAA received 145 training in 145 different courses, or they all participated in a number of courses. I guess it's not 145 courses, but there were a lot of folks in a lot of courses. And let me kind of give you a feel for the range of those courses. One dealt with Alzheimer's and dementia issues. Another was how to really ask inclusive intake questions. Another was enriching care for LGBT older adults of color. Another on HIV and aging. Another on identifying and supporting caregivers in the community. Preventing bullying, supporting LGBT plus people, transgender aging. And so that was really a focused training of the staff members themselves. As a counterpoint, um, Sonoma County, which is mostly a rural county, actually had a training for caregivers that trained direct services staff, but also caregivers, where 70 caregivers in Sonoma County were trained through 8 workshops. And that was a case where the AAA worked closely with SAGE and also with a local provider in the county. So what you find is this has worked out with, there's been some centrally led trainings that we've done as an association, but then also individual AAAs, which have worked directly with SAGE, and kind of tailored the coursework depending on the needs of the local AAA, whether it's a staff focus or whether it's a community partner, such as the caregivers. I would say one other thing, there are mandates in California for cultural competency training, particularly in the area of adult protective services. So that creates opportunities and obligations on the part of the AAAs to actually engage in that training. So we do have incentives at work in California that may not all be, the same everywhere else.
Yeah, that's helpful. And I know it's still early, but I wonder, do you have outcomes, responses from clients served who have noticed a difference in how services are being delivered, and that this is perhaps a step in the right direction?
I think one of the difficulties and that Sage can probably describe
Sure.
even better than I can, is really the issue of how do you ask questions in a sensitive way to individuals who may not really want to deal with it. I mean, and these are service recipients, and as well as staff members. There's, and adult protective services is a good area because historically there are some issues there around staff wanting to ask those questions because they need to be taken through a stepwise process to feel more comfortable doing that. And SAGE has been very effective at doing that. I don't know, we don't collect those kinds of numbers, but in anecdotal evidence, we kind of know that people find the course very helpful. And then, when the rubber hits the road is really, well, are these are then the intake questions being asked in a way that it facilitates an answer. And we found that that's been the case too. And so I don't know that we collect locally outcomes data, but perhaps SAGE does.
Yeah, that's great. Cheryl, anything to add on that front?
Yeah, I was gonna say through SAGEcare, we actually do evaluate the training. And time again, what we do learn is that the cultural competency training really does help people feel more supported and comfortable, in serving LGBTQ plus older adults. And so we see that pretty consistently, throughout our evaluation work that we do. And then I would also say on the flip side, oftentimes when we do a training, people may come to us and say, well, we went through this cultural competency training, but we really haven't received, more people signing up for programs who are LGBTQ. What we need to recognize is, we're not here to like encourage people to come out, because that is still very personable or personal to each individual. But what we need to know is that because we're doing this training, because we're doing this work, people feel more comfortable just seeking services. Because what we've learned up till today is that a majority of LGBTQ plus older adults delay seeking services simply out of fear of discrimination and ongoing stigma. And so over time, hopefully we'll see those numbers start to come down, where
Mhm.
more of us do feel comfortable to seek these needed services that are so critical, and that are provided through the area agencies on aging.
Mhm. Yep.
would
Makes sense.
also
Sadia?
add that it is not just about preparing for the individuals that we have accessing care right now, but preparing ourselves for the future. We know that as we move forward in time, more individuals accessing care will be identifying as members of the LGBTQ plus community. And we also know that our older adults have more children, grandchildren, nieces, nephews, aunts, uncles that identify as LGBTQ. So it is also about maintaining access to community and enriching the lives of our older adults to ensure that they have the tools and skills necessary to maintain communication with their LGBTQ plus community members and family members. So I think one thing folks forget is that it's not just about the elder themselves, but about their community and their family. And that by enriching those connections, we're adding to, or not adding to, but we're helping with those issues of isolation that may pop up.
Mhm. Sure. Yeah, makes a lot of sense. So before I shift us into kind of the funder side of this, because I know we had a question from someone and Cheryl did answer it, but I want to make sure everyone saw the answers. How do local area agencies on aging get connected with the trainings available through SAGEcare? And so we will share this link out, but really it's simple as going to sageusa.care and completing the request form through the contact us link. So Cheryl, if you could speak a little more to that, but also just give us a picture of, the country, where are you seeing really exciting things, some of these partnerships popping up outside of California, and what's your, goal here for, your vision of how you really see this rolling out through this incredible network of AAAs across the country?
Yeah, and I would eh, so what the training looks like, because of our partnership with the Administration on Community Living, we do have the free of charge offering. It's conducted through our learning management system. They're recorded webinars, so staff can go in and really take that training, at a time that's convenient for them. And it's a way to make sure that, we're providing that training, across the country. If folks want something more specialized, then they can work with our SAGEcare team, and they can, develop a package. So you can extend out beyond your area agency on aging and make sure that the organizations that you're contracting with, that they also have the opportunity to take part in the training. SAGEcare can work on a package to deliver management training. We can also do in person. Sadia loves to travel and meet with agencies in person. And so there are, a number of different ways that we can really customize that training work. The exciting part is, California, we know that California is seen as being more progressive. They have requirements for training, but we also see states like Kentucky and Arkansas and Texas and Oklahoma who are joining in this work to make sure that, their area agencies on aging have access to this training. I believe we've trained in all 50 states across the country now. Is that correct, Sadia? I know there for a while it was like we were trying to get, one outlier, but I
We
believe
are
we've
literally just missing North Dakota.
North
If
Dakota.
anyone could connect us with anybody in North Dakota, we will be able to say 50 states trained.
Okay, so 49 states.
Yeah.
And a number of area agencies on aging across the country, are joining us in this work.
That's great. So, and I know we're talking about area agencies on aging, but that prompted, I mean, there's
Yes.
other organizations, because the reality is that not everyone is served by an area agency on aging. So there's other organizations, other points of entry, other entities that could benefit from this. So talk a little bit about like who else has benefited from these types of trainings outside of the network of AAAs.
So
Sadia, go ahead.
yeah, absolutely. So out of the 5 top kind of long-term care communities, we've trained 3 of them and have long-term relationships and kind of all expansive relationships with 3 of them. And we've trained hundreds of long-term care communities. I think at this point we've hit, I'll have to find the exact number. As someone else is speaking, I'll find you the exact number. But we've hit the point where we have touched the long-term care community in a way that we've been able to really make an impact on how LGBTQ plus older adults are served. Across all 50 states or 49 states, North Dakota, I swear, just give me somebody in North Dakota. 49 states, including Puerto Rico as well. We've been able to make an impact on the larger, more financially kind of, well, I guess to be honest, in long-term care, you have the communities that require a lot of financial support ahead of time. You have companies that require a lot of money to engage with and to live with. And then you have communities that are really kind of the mom and pop that are really focused on the folks in their area. So by working with those larger communities and engaging with those larger communities, we're able to take money off of the cost for training communities that are kind of more local, more rural. Our goal really is to focus on reaching communities or reaching long-term care communities and independent living communities that are focused on serving the most necessary populations, the areas that are focused on people of color, on folks who have issues with poverty. Our goal really is to help folks who have the most need. And so by engaging with these larger long-term care companies, we're able to offset the cost for folks that really need our support and our help.
Very smart, makes sense. So we are a network of funders, as I mentioned, and so I want to really talk about kind of the funder angle of this and what funders can do to support these partnerships. So I have a couple ways that I'm going to ask that. And first is to Michael, because I think when you look at really the role of AAAs, there's an expanding role that we're seeing pop up across the country. And so I wonder if you could talk just briefly about what are the best ways that private funders, because we see you as a funder as well, how private funders could better partner with the AAA network in their region. And then I'll talk a little bit, and we can ask another question about this. But ways that funders should be thinking about supporting AAA and the work that they're doing in their region.
Sure, happy to. Before I kind of get into that answer, I think it's important to point out that the AAAs are structured and formed differently across the country. In California, 2/3 of them are county-based and are actually government agencies, but a third aren't. And the third that aren't are either sort of multi-county entities that exist independent of any county, and they're nonprofits, or individual nonprofits that are the AAA in their county. And so that third that essentially are non-governmental nonprofits would really be like any nonprofit organization, 501c3, and the funding approaches to support their programming, say development of a cultural competency training capability, that would work in the same way as any 501c3. With the county structure, it obviously gets more complicated, but it would be like funding. It would involve the same process as funding government programs or contributing to pilots, which would be probably very beneficial. In California, we're very lucky to have Archstone and Scan Foundation and a number of other foundations that support us, and in a way we're probably luckier than many states. But if I were a grant maker whose primary area was the Midwest, I would focus on AAAs in the Midwest, and I think you'd really find a welcome, the welcome wagon would be out. Um, and also, it's not, again, it's the AAA may provide the service directly, but in a lot of situations, it's really a mixed model where they either provide a service or they contract out with community partners. So AAAs become a channel to actually reach the community partners for funding purposes, or at least as a contact point to get further information about partners in the community that a funder might want to work with. A meal program is a typical example of that. Meal programs are everywhere. Meals on Wheels is everywhere. There are local meal providers as well, and they're often part of a AAA network. But obviously could also be approached directly.
Yeah, thanks. That's very helpful. To Sadia and Cheryl, what would your perspective be on how funders can engage in this work? If you're seeing other things, other examples, please share that. But what should funders consider in supporting this built partnership that you've really been expanding over the past few years?
Yeah, I'll jump in first and then let Sadia jump in as well. One of the things Michael talked about early on was mandates for training. We're seeing more and more states implement mandates around cultural competency training. Oftentimes that mandate doesn't come with funding to implement the training. And so that can be a really critical place where, I think grant makers in aging and other funders can help, step into that role and work with groups like C4A and SAGE and other groups that may be providing training to form these types of partnerships so that we can ensure that the training is getting out to the community and that an unfunded training mandate can actually be accomplished, right? And so that's one of the things that I think is critical. We also, can work with a AAA who may be wanting to offer the training to the larger aging network in their community. And so that's where funding can really be helpful because, the SAGEcare and National Resource Center training is limited in our scope as far as being able to get out into the community. So funding partnerships can really help ensure that we're reaching, as many people as possible. And I'll also just quickly add that we oftentimes get asked to come and speak at conferences like C4A's conference. And, that isn't something that SAGE has oftentimes budgeted for. You'll find us at a lot of our national conferences, but to be able to go to a state conference or a local community conference, that can also require, funding to help with that. So those are types of partnerships, where funders could help make sure that we're getting to the places where people need the training the most.
Yep, that's really helpful to hear. There's nothing worse than an unfunded mandate.
All right.
When you expect the AAAs are, there's so much required, and if you're not supporting that, then that's clearly an issue. Michael, did you have something to add to that?
Yeah, I can't pass on commenting on unfunded mandates because I live in a state that can't get enough of them. So yes, I mean, my members would particularly welcome and their community partners help, some help in addressing unfunded mandates.
That's great. All right, so we have I'm just monitoring our questions from the audience, and just a reminder that anyone can pop in and we'll address the questions. But this is a general one, and I think I can fill in the missing word here, but and maybe rural communities or smaller communities strategies. And Sadia, maybe this is to you when you're thinking of developing the training. How do you kind of create that sense of safety and security, inclusion when a AAA is doing assessments or other programs, how do you bolster and really make sure that there's a sense of safety in that? What would your recommendations be there?
Sure. So our approach to trainings is that it really is about providing person-centered care. So when it comes to your religious connection, when it comes to your personal moral understanding of whether being LGBT is okay or not, I, of course, have an underlying connection to that. I hope that you are pro-LGBT, but really when it comes to the work, it's about person-centered care. So we as care providers are mandated to care for anyone. It doesn't matter who walks through your doors. It doesn't matter who is seeking care. Your goal is to provide the best care possible. In order to do that, you have to understand who they are. You have to understand what history has done to them, what culture has done to them, how they have worked through being accepted or unaccepted through their lives, right? All of this is key and important to providing that person-centered care, right? Our goal, your morals, your understanding, all of those things to the side, we really have to focus on the person and understanding LGBT history, LGBT language, what it means to really connect with this individual. That's all a part of that person-centered care. You can't do that if you don't have these trainings. You can't do that unless you understand what it means to talk to someone else and use this correct language. So I think the way that we approach it is really about how to do your job to the best of your ability. Take your personal beliefs and put them to the side and focus on what it means to be the best care provider.
Right. Yeah. Thank you, Sadia. That's very helpful. And thank you, Cheryl, for the question. Okay, another question to ask you about the SAGE certification courses. So who would like to ask that? Is that to you, Cheryl, perhaps?
That's me.
Oh, that's
Oh, that's
Sadia.
you. Okay, back to Sadia.
Sure. So we recently changed the way that we certify individuals. Back about a year, 2 years ago, we had multiple stages of certification. Now things are a little bit different. So if you can get 50% of your management and your staff to take a SAGEcare training, you're SAGEcare certified. If you can get 80% of your staff to take 80% of your management to take the management training and 80% of your staff to take the staff training, then you're platinum certified. So the idea here is that the SAGEcare courses for staff members are an hour long, and they cover a lot of the topics that Michael mentioned. The management training really is about culture change. When we talk about something like California is mandated to require questions around sexual orientation and gender identity. Well, when you're asking questions about sexual orientation and gender identity, what you're asking is folks to out themselves. You're saying, tell me if you are a member of the community. But what you're not guaranteeing is any kind of safety around that. If you out yourself, what if someone mistreats you? What if a staff member or a fellow resident or a fellow community member mistreats you? What if you are discriminated against? How are you protected? None of that is covered, right? So our management training, our kind of deeper dive trainings are really about how to put the practices, policies, the safety in place so that when someone outs themselves, they feel comfortable doing so, right? How do you ensure that both your staff members and your residents or community members accessing your services who identify as LGBT feel comfortable, confident, and safe engaging with those services?
Yeah, great. Thank you, Sadia, for responding to that. And good to know about that. And Michael, and then maybe to Cheryl to comment on that as well.
Yes, I'd just like to jump in for a second. and go back to a point that was made at the very beginning around that Jasmine actually mentioned around the integration of social and healthcare services. My background was actually in health policy for many years, and I worked in an environment where uh, gradually, we started integrating social services more into healthcare services. And um, generally would observe that in order for that to really happen, a number of things have to be met. And one of them is on the social service provision side, there have to be some quality control measures and quality improvement and process improvement integrated into how social services are provided in a way that it is happening on the healthcare side and has happened for many years. So I kind of see for the AAAs and for the service providers that certification and is a form of that, is a form of upgrading the process and really providing some quality control. And that is something that is good for service recipients certainly, and also I think facilitates this continued integration of social and healthcare services.
Mhm. Yeah, that makes a lot of sense. Cheryl, anything additional? This has been a great conversation, but I realize I've been skipping you perhaps. So anything to kind of reflect on some of these last questions?
Don't feel like you've ever skipped me. I always like to refer to myself as the closer, so we're all good. I did want to reflect back on the one question around very conservative communities and how do we support people without outing them. This is a question we oftentimes get is, should we, I'm in a rural community, I'm in a very conservative community, should we have drag bingo as, an event for LGBTQ plus older adults? In those rural communities, people may not be as accustomed to going to LGBTQ exclusive events, but they are accustomed to going to, the community potluck or, the Wednesday dinner at the senior center. What's most important is that people know they're welcomed and supported. So we really encourage people, take a look at your non-discrimination policies. Are they inclusive of sexual orientation and gender identity? Take a look at your marketing materials. Do people see themselves reflected? Can they look at your website and see two people having coffee and think, oh, maybe that is representative of me and my wife? Look at your images, look at your messaging. If you're doing outreach at a farmer's market, make sure that you have marketing materials that, maybe they have a little SAGEcare credential sticker because you've gone through training, at the bottom of the brochure. Those are all things that will let people know this is maybe a place I can receive services where I'm going to be safe and welcomed. And so
Mhm.
that's really the key to what we're trying to do here.
Yeah, that's a really great point, Cheryl. Thank you. Um, all right. Well, I'm going to be the closer too. So and I like this question that has just come in. So I'm going to incorporate that into asking you to close all of you with some final remarks. So it's the idea around how do you make sure that this is not just checking the box. I don't know how often this training is done, but there's certainly a lot of training. To Michael's point, a lot of things are mandated. Different types of training. I used to work for an area agency on aging. I can speak to that. There's a lot of important things, of course, that we need to be trained on. But how do you make sure that this is kind of integrated into the work that you provide and it's not separate, or it's not this like siloed thing, like, okay, now we have our cultural competency training. How do you really incorporate this into your work going forward, so that it's not just a one-time thing? And so anyone can start, but that'll be my final question to all of you.
I'm going to start and I'm going to say it can very easily take that place. It can very easily just become a checkbox, right? But I think it really comes down to the understanding that it's not how you use technology training. It's not like a training that you take every year just to say that you've taken it. It really is about the impact that it has on real live humans. These are individuals who have experienced a significant amount of discrimination in their lives. And it's not random people. It's who I'm going to be in 20 years. It's the people that I serve day in and day out. These are real live human beings that need services and need care. But it's not a topic we talk about. It's not something we discuss on a regular basis. So trainings like what we provide and what many other people provide, it's not just us. You can find amazing organizations that do what we do. Maybe not at the national level we do it, but locally you can find folks who do what we do. If you don't, if you don't want SAGE doing it, that's fine, that's okay. But find someone who does this work, because it is so critically important to such a significant part of the population to be trained, to be able to have this conversation, to be comfortable talking about these issues, because it's not just, 10% of the population. It's about my future. It's the future of my family. It really is integral to creating an inclusive environment for all people. So you can very easily check a box, but I think remembering the human component of this is key. I also think that it comes down to engagement from a corporate or management level. If your organizations are having weekly, monthly, bi-weekly meetings, making sure that, when you have those bi-weekly meetings, having some engagement opportunities, right? Case studies, ways to engage referral services, or engage individuals who are working at your organization on questions and comments that may come in. You can create case studies and have conversations. It's about continually engaging that conversation, continually engaging and learning. So we can do a significant amount of the learning, but it really is up to the AAAs to continue that learning in the long term. SAGEcare does have consulting services. So if you're really invested, and if you really, understand that your community is in need of this, we can help you with your policies and procedures, your HR documentation, your paperwork. We can do the work to ensure that your engagement with the community, whatever it looks like, whatever the paperwork is inclusive towards LGBT older adults. But I'm not going to lie, a lot of it comes down to the work that you do day in and day out. It comes down to whether you believe that this is a community that needs support and engagement, and how you rise to the occasion. And we can help you with that.
Thank you, Sadia. Cheryl?
Yeah, I would also say that even though we've talked a lot about mandated trainings and required trainings, so many of the organizations that SAGE trains, they're coming to us because they want to serve LGBTQ plus older adults. They want to make sure that their employees have the skills needed to be truly inclusive. And so I think that's how we see that it's not just checking a box. Companies and nonprofits are making an investment in the ongoing education, of their staff. And, that also creates a better environment for the employees, their families, as well as the broader community. So I think that's one way that we see that this really isn't just checking the box.
Yeah, thank you, Cheryl. And Michael?
I think if you sort of look at success factors contributing to continual meaningfulness of the activity, there are a couple that kind of pop out. One of them is the context that the agency or the provider is living in. It's relatively easy in San Francisco and LA, for example, to do cultural competency trainings, because it's an environment that is conducive to that, and for many different reasons. It's harder in rural areas and maybe smaller cities. But what I've noticed is that where there is where it's sort of worked and continued, and it's not just checking the box in smaller cities and rural areas, it's often because the management of the AAA is committed to it, is committed to making this a meaningful activity. And that sometimes is because the directors are actually LGBTQ people, but often it's because there's a sensibility that's been inculcated in management that says this is an important thing for us to do, and it's an ongoing commitment, and that seems to be another success factor. But I think for us as C4A, we want to continue to promote certification, ongoing training, and we'll continue to do that because it also is important to get nudged. I think I like nudging my members, and since one of my members is in the audience for this, I think I'm going to hear about that. But it is important for this association to actually promote things that are of benefit. So that's an important success factor as well.
Sure. Yeah, thank you, Michael. Well, we are at the end of our hour, so I want to thank Sadia, thank Cheryl and Michael for all your work that you do and for sharing your expertise with us today. And thank you to Jasmine and Carly and the whole team at Archstone Foundation for their great work. And thank you to the Johnny Hartford Foundation for supporting our monthly webinar series. As a reminder, we will be sharing the audio recording from today's presentation, and we encourage you to share that with your colleagues. And we will also share some of the resources that were mentioned today, and including how you can get more connected with SAGE. GIA members can join us for some of our upcoming member meetups on the screen. So we've got a lot of things happening later this month and in February. So you can visit our website to learn more. And everyone, please follow us. We have a lot of ways that we share resources. So please share on all the socials, share us and learn more about our work in those ways. And finally, I want to thank all of you for participating in today's conversation. We hope you'll join us again next time, and please be well. Thank you.